Waitlists and staff shortages are an ongoing issue in the allied health profession. When the pandemic started to impact the Australian economy, the waitlist for allied health services grew exponentially. Millions of people around Australia were encouraged to stay home and avoid in-person appointments for the foreseeable future. So both wait times for existing appointments and new people seeking mental health services were longer. There was even a call out for trainee and retired therapists to return to the workforce. More people needed to access mental health support services, and some had to even resort to seeking emergency medical assistance after waitlist situations didn't improve. Organisations like Lifeline and Beyond Blue had record-breaking numbers of people calling them for crisis support, a 30 to 40% increase in demand year on year. My name is Laura Simmons, and I'm an occupational therapist and the creator of Theratrak. My co-presenter, Danielle Graber, is the founder and director of 12-Point Psychology in Victoria. Today, I'll be presenting to you on our joint project that looked at the impact of using Theratrak to deliver a clinician-monitored psychoeducational program, Therapy Bytes, to participants who were stuck on waitlists and unable to access one-to-one treatment in 2021. What we're going to cover today is a bit of a background around the program, the implementation of the Therapy Bytes program on Theratrak, the outcomes of the program, conclusion, and what's next.
So, thank you, Laura. So to start off with, my name's Danielle Graber. I'm a clinical psychologist and I'm the founder and director of 12-Point Psychology in Ferntree Gully, Melbourne. I also run a program called Therapeutic Tools of the Trade, which is around supporting clinicians to provide the best support to their clients. And both of those, the practice and the therapeutic tools of the trade group, is around making psychology more accessible. So the problem was absolutely everyone was overwhelmed. We're in Melbourne. We had, 2 years where you didn't see much of the sun or of anybody else. And the mental health burden of that was huge. We found by the start of 2021, so 10 months into the pandemic, we'd had a 350% increase in referrals, which was devastating for those people who were calling up and trying to get in, but devastating for the staff as well. So the clinicians, the admin team, nobody does this job because they don't want to help people. So not being able to help those people was really frustrating for us as well, and was really contributing to our feelings of burnout. So we knew we needed to do something for us and for the clients. So I came across Theratrak because I was looking for a way to engage the clients more actively in between sessions, especially as to try and fit more people in. The existing clients, we were spacing their sessions further and further apart, so they also needed more help in between sessions. And we know that anything that helps motivate the client to engage in change-related behaviours in between sessions is what's really going to lead to lasting change. The hour that you spend with your clinician in session is great and helpful and totally necessary. But if you really want to see long-term change from that, you have to take what's discussed in that session and apply it. And I thought Theratrak would be a really good way just to help prompt clients as they're starting to integrate a new habit. Would be something that gives them a chance to go, oh, that's right, I'm getting a notification on my phone. I need to practice my deep breathing exercise right now. I also really liked that it was an Australian-based company and it was started by someone in allied health who knows exactly how important it is to motivate those clients in between sessions. And once I started using Theratrak just for my regular client engagement, sending them out homework tasks in between time, sending them out prompts, don't forget to practice your deep breathing or whatever it might be, I started thinking about ways that we could use it to disseminate this fairly basic psychological knowledge to more people than just our existing client base. And that was when I started thinking about Therapy Bytes. So Therapy Bytes started as a what are some of the topics that I find myself discussing with clients again and again. So I put together a collection of slides. I made a bunch of videos. I spent a lot of time in our completely empty office talking to a computer, and talking about basic flight and fight, basic breathing techniques and why we use them to counter stress, how they're helpful, how to identify and deal with automatic negative thoughts. And I put them all into 8 modules, going from sort of basic to slightly more advanced basic, if that makes sense. We've got the sort of the foundational and then the advanced modules, to really help people take charge of their mental health and give them something to focus on, something really positive to focus on and take away in the midst of all of this chaos that was going on at the time. So the program was ready to go. The modules were up and ready to go. It just became about then, how do I deliver this program to the participants, which was where Theratrak came in.
So how does Theratrak work? So therapists use our mobile app in therapy sessions to capture and digitize meaningful information from a therapy session, and then send this home with trackable notifications. So Danielle uploaded the Therapy Bytes program to Theratrak and was able to quickly and easily send each of the programs. Participants had access to the gamified app for free. They could easily review where they were up to in each of their programs, view each of the modules that they were completing. And then the data that was captured on the participant app, it fed the tracking system, which created real-time progress reports for Danielle.
So we've got the app now, we've got the program, and we decided to see if this, because as far as I knew, this wasn't something that had sort of been done before. So we wanted to see if people would take it up, and if it would be effective at all. So we had our intake team who were taking all of these phone calls from people who were wanting to see therapists, and we would give them all of the normal information. So this is the current wait time. These are the other referral streams or options that you have access to. There is also an online program you could try if you would like to. If they wanted to, then they moved on to the pre-evaluation phase, where they completed some basic psychometric questionnaires like the DAS and the Core 10, and that helped us to understand, is this person suitable for an online program? So clients then completed the modules at their own pace. We sent them out once a week. So module 1 went out in week 1, module 2 in week 2, but the clients had access to it for 6 months. So they could really take their time. They could go back, they could revisit modules, they could download worksheets. It really was something they could sort of pick and choose where they wanted to spend the most time, focusing. So the outcomes were, in the end, we had 37 people sign up, and 33 of those completed all 8 modules and the assessment measures, the pre and post assessment measures. So those are the ones that we're sort of looking at here. Of the 33 who completed, and quite surprisingly, 100% of them had shown improvement on at least one of the measures. So they might still be above the cutoff for depression, for example, but they might have gone from severe to moderate. And the stats that we ran on that showed it was a statistically significant reduction across the board, which was quite amazing, and certainly very gratifying. You know, it worked.
But I think what it really shows is that technology really provides a novel and low-cost support system to those on waitlist and mental health services. Mental health professionals can use platforms like Theratrak to create therapy programs and provide positive solutions to long waiting lists and an ever-changing workforce. I think that Theratrak is never really to replace the individual therapy, but might help participants integrate the therapy strategies more easily into everyday life.
Yeah.
What I think is really cool is the plans for Therapy Bytes in the future. I know, Danielle, you're working to integrate Theratrak and Therapy Bytes into all of 12-point psychology, so that if a topic is briefly discussed in a therapy session, that, for example, a mindfulness exercise psychologist can prescribe the full mindfulness module to a client in
Yes.
between these sessions, which I think is really, really helpful.
Yes.
And I think because there's such a demand for mental health education and support from so many different groups, I know that you're looking to create different versions of the program as well. So one for kids with anxiety, one for parents, teens, and maybe even one for healthcare professionals to help
That
us
would
with
be,
burnout.
yes, that would be excellent. We did have a few mental health professionals doing the pilot program. They all did the stress module, funnily enough, they all responded really well. Well, they all were part of the 100% who showed improvement, and who were able to take some of those strategies as well and sort of almost remind them of some of the basics that we sometimes forget when we get caught up in our day-to-day work.
Exactly. And I think one of the other cool things that's come out of this is what we've found at Theratrak is that this waitlist opportunity, the waitlists are across the board. It's in OT, it's in speech, it's in psychology. And we found other therapists that are using Theratrak are actually using this waitlist supported model in both pediatrics and rural and remote health communities, which is really, really cool as well.
Yeah, no, I think it's fabulous. There's only so many of us to go around, so
there's not enough of us. There's
no.
not enough of us for sure. But yes, I want to say thank you to everyone for listening to our presentation, and please reach out if you have any questions for myself about Theratrak or with Danielle about the Therapy Bytes program, and we'd be more than happy to help.
Yes, thank you so much.
Thanks, everyone.